I have to imagine that it opens up an entire world for them because they can hear out of both ears. From our perspective, one of the main things that we think about is safety. When a child can't hear out of one side of their head because of an absent ear canal, for example, and they're running around outside on the street, they will have more difficulty localizing sound. In other words, figuring out where somebody's voice might be coming from, which direction. But also, when there's a car or a motorcycle or a bicyclist on the side of the head with decreased hearing, the child will have a difficult time hearing the noises. And so by placing these devices on, it gives them a degree of safety that many people don't even consider. Apart from that, it's an electronic device, so children need to take care of them. The families need to take care of them. It's not uncommon for these devices to be damaged, but fortunately, there are pretty reasonable and robust methods for getting these replaced or fixed for the children. They can't swim with it, unfortunately, although it is water resistant, so playing out in the rain, where there's some moisture is totally fine and perfectly safe. The other aspect that many children and parents don't realize is that a lot of sports and activities nowadays require helmets. And so one of the big questions parents always have is, can the device even be fitted when a child is wearing a helmet? And the answer is, in most cases, yes. I often will show and describe how you can take a little knife and cut out a square of foam in a bike helmet or a ski helmet or a football helmet so the child can actually wear the helmet with the device in place, which is great for them when they're performing their activities. They can hear better. I have to give all the credit to our audiologists. To be honest, I'm the guy that does the surgical implantation. I have, based on my examination and history taking of the family and the child, I'm the guy who may say, you know what, this child is not ready or this surgery is not indicated at this time. But apart from that, it's the audiology team, I think, that really manages these kids and gets them all teed up for the surgeries when it comes to that age. They're the ones who see the kids at age 1 month, 5 months, 6 months to get them fitted with a soft band. And they're the ones who follow these kids, test their hearing, adjust the devices throughout those years before I even see them at age 4.5 or 5 for the surgery.